All right, well, welcome everyone. Thank you for joining us today. Before we start, I want to acknowledge the traditional owners of the lands and waterways that we all find ourselves on today. We're coming from across the state, so we're on many different lands in many different parts of Victoria. I'm on the lands of the Pangarang Yorta Yorta people here in Wangaratta, and I pay my respects to elders past and present and acknowledge their ongoing and unbroken connection to the land. So this is part 2 in our 2-part series focusing on ageing, connection and participation. So in this series, we're looking at how organisations and communities across Victoria are understanding the concept of connection and participation and how they're responding to this at their local level. So last week in part 1, we saw the way that 2 local councils responded to this during the COVID lockdowns in metropolitan Melbourne. And looked at the way that they focused on material contribution to others and you know, how that fosters a sense of connection, even though you might never meet the person that you're making a material contribution towards. And then we also saw the way that organisations like local governments have a key role in addressing some of the structural issues and creating an environment where opportunities for connection and participation are made easier. And through both supporting groups to be sustainable, as well as supporting intergenerational mixing and ensuring that every club or group is welcoming for anyone who might be interested in what those clubs and groups do. And today we're going to continue that theme, and we're going to look at the way 3 organisations within the North East region are supporting older people to remain connected and supporting people as they age to remain connected. So we're going to start looking at, we're going to start this by first looking at a program that was put together as part of bushfire recovery after the 2019-2020 bushfires and how shared physical activity supports connection. And then we'll move towards 2 responses that examine the local environment and the physical and relational factors that might either facilitate or act as barriers to connection and participation. But before we move to our presentation portion of today, I really want us to focus on our own connection. So as everyone knows, for the past 2 years, we've been doing a lot of these online events and coming together in a virtual space. And that's got its advantages. I mean, today we're coming from, I can see Linda from Mildura. So these sorts of you know, online platforms are really great for bringing us all together. But it does mean that we miss those opportunities for incidental connection and those sorts of conversations that you might have standing around the coffee urn or the cake and the fruit plate table in the afternoon. So as COVID restrictions start to ease and you know, we start to head back into face-to-face events, I thought this was a good opportunity to refresh some of our small talk skills and just take a few minutes to have a short conversation over a cup of tea and just work and see who else is in the room today and who's part of our session. So I'm going to mix this up into a few different groups. I can see we've got 15 in the room at the moment. So I'll mix this up into maybe groups of 3 or 4. And so for the next 5 minutes, if you just want to take a moment to introduce yourself, say where you're from, which organisation you're from, and what your interest in ageing or social connection is. And there's not going to be any report back or anything like that. This is just an opportunity to have a conversation with somebody else in the room and to be able to you know, take that conversation wherever you like. So I can see a few more people are coming in now. So was there more about to come in, Naomi? I might do us in, I'll do groups of 4. So everybody who's just come in, we're just going to do a very short sort of welcome and introduction to a couple of other people in the room. So all you need to do is just introduce yourself and your organisation and what interests you about either ageing or social connection.
And yes, we're...
Hi everyone. I hope that was a really energizing session, just to meet a few of the other people around the virtual room. And I realised I neglected to introduce myself. So my name is James. I'm the Senior Officer for Age Friendly North East Victoria, and the organiser of today's event. So we'll now move into our presentation part of the session. And I want to introduce, first like to introduce Leah Cooper. And Leah is an accredited exercise physiologist at Equilibre Health Solutions, which I believe are based in Mount Beauty and Bright. And Leah is going to be discussing a project that she led as part of the region's bushfire recovery. So Leah, I'll hand over to you.
Thank you. I'm just going to work out to share my screen. Can you see my PowerPoint, everybody?
Yeah, that's come through. Okay,
I can't seem to share it as a slide, so I'm not sure what it looks like to you, but I'll try and navigate my way through. Yeah, so good afternoon, everyone, and thank you for inviting me, James, to speak today about a project I was involved in 2020, following the devastating summer bushfires of 2019 and 20. Just to give you a little bit of background, this project wasn't necessarily started to service the older adult population in our community, but hopefully you'll see how it has evolved into providing another physical activity option for older members of my community and the community of Alpine Shire. So as a bit of background and context, I work as a private exercise physiologist, and I service the entire Alpine Shire region. I run as a sole practitioner and as a sole trader. So my business mainly focuses on chronic disease prevention and management, and my clientele generally are referred through GP or specialist referrals. And I would say that probably around 70 to 80% of my clients are 65 years and over. And I think that's just generally because I'm working in that chronic disease management realm. Yeah. So thinking back to January 2020, we had in the Alpine Shire, a large proportion of our Shire was under threat from the bushfire crisis, and some areas, or a lot of areas actually, were directly impacted by bushfires. So Alpine Shire residents were evacuated on a number of occasions. I think it was about 2 or 3 times for me. I live out at Wodonga. And we were evacuated because of the fires, and then we came back to and were affected by constant thick smoke and poor air quality for weeks, if not months afterwards. So the months afterwards was then because of ongoing backburning and hazard reduction that was occurring in the months afterwards, after these fires. So the fires placed a significant strain on the community spirit, the local economy, because our local community relies heavily on tourism, and the ability really to lead normal everyday lives over this time, particularly with remaining physically active and having that normal social connection that we would normally have. This was potentially as a result of both the actual evacuations and not being with friends and families, but also as a result of sort of stress and anxiety and ongoing mental health issues. So as a result of this sort of traumatic event. So what happened from that was, as living in this community and being and seeing it and working with people who were directly affected, I suppose I could feel and see both the physical and the mental stresses that the bushfires were placing on people, including myself. So I'm friends with and colleagues with another exercise physiologist who works from Myrtleford. Her name's Greta. And we heard about a bushfire grant that our professional association, ESSA, so Exercise and Sports Science Australia, were offering. So we decided to work out how we could encourage people to get back into some physical activity outdoors, as well as socially reconnect. And I suppose to reduce the time burden of such a project, because we are both sole traders, we decided to collaborate. And I also have quite a strong working relationship with Alpine Health, so we approached them as well to see if they could offer us additional support. I suppose we also thought, well, really, how could exercise help? So help these people to reconnect and get on with life, I suppose. So not only, many people had been limiting their physical activity, particularly over the summer months leading up to the bushfires, because it was a really, really hot season. But also then because of the poor air quality. So lots of people were told, and I was advising even, that people shouldn't be out in port with the horrendous air quality that we had. So I suppose it was a bit of a two-pronged burden there. Physical activity and exercise is also linked to improved quality of life, reducing chronic disease risk, and also managing many chronic diseases, health conditions such as cardiovascular disease, diabetes, certain cancers, anxiety and depression, and mental health disorders. So we knew before the bushfires that many of these conditions have a higher rate in the Alpine Shire, being a rural area, compared to state and national rates. And this was going to be compounded by the effects of the bushfires. So we knew that exercise was particularly beneficial in addressing some of these bushfire health related health risks. Whoops. So then we had to work out what we were going to do. So we knew we wanted to run some groups to reach more people in the community over a short amount of funding time, and also promote, we wanted to promote those social benefits of exercising together. We also thought about, are we really accessing parts of our community or people in our community who are not normally physically active? Because if we're just getting the people who are already, engaged, well, that's not really addressing why we're doing this. So then we came up with the idea of Nordic walking. One of the initial reason, I suppose, was we had the skills. So I'm a Nordic walking instructor. One of our colleagues at Alpine Health is also a Nordic walking instructor. So we knew we could easily deliver this sort of type of activity. It's also, Nordic walking is also an accessible type of activity, particularly for older adults, because it helps by improving confidence, by providing more stability and balance with the use of poles, providing less impact on the knees and hips particularly, as well as providing a greater fitness and health benefit than you would normally get with walking. So for those of you who don't know, Nordic walking is using a specific type of pole, using a specific type of instruction and technique to get all these health benefits. What we also thought was, okay, how can we spend the money? Well, we thought we could use the grant to fund some of these poles for use at the group, and then we would with the idea that we would make these available for hire after the groups were completed for more of a sustainable option. And we weren't allowed to charge as part of the grant, so there was no cost to participants. And being outside, we didn't have to rent or hire spaces, which was really good. So then came COVID to compound all of this. So we had to reschedule our groups. We anticipated we'd start in March, April, and we ended up doing these running these groups in the later part of 2020. But as time went on, we knew that we felt we needed to stick with this, because it was an even more important reason to run the groups, because of increasing isolation, increasing mental health issues, and potentially an increase or a reduction in physical activity as well over COVID lockdowns. Sorry. So what did we do? we ran 8 one-hour supervised Nordic walking groups across both Myrtleford and Bright, and they were done over 5 weeks because we had some inclement weather on our 4th week. Groups were restricted because of COVID restrictions at the time to 20 participants, and we were able to increase to 20 because we had 2 instructors who we were able to divvy up into 2 groups. And at this point in time, we had anticipated that this was open to all members of our community, or all adults in our community. So we promoted through social media, local radio, newspaper, existing clientele, word of mouth, that sort of thing. And we also, I suppose it's part of our work process anyway, but we utilise the excuse me, adult pre-exercise screening system to screen for existing health conditions and to gain some a clearance for exercise, if you like, or just getting people to go back to their doctor and making sure that they're healthy enough to exercise. So screening is really important, particularly for moving on with age or becoming older, because there's more risk of having existing health conditions. So essentially it was part of our risk management process to do that. And we didn't screen out anybody as a result of using that. We had to get some clearances, but no one was screened out and unable to participate. So our outcomes, we had 32 participants register. We had some more interest, but some people weren't able to come on the days. And in the end, majority of our participants were 65 years and over. We're unsure, potentially time of day. We ran it mid-morning on a weekday. Obviously, people who are working, younger people, may not have been able to come for that reason. A couple of other outcomes were, as you can see down at the bottom of the slide, our participation was pretty good the whole 4 weeks or 5 weeks, except on the last week, Bright had a bit of a reduction in numbers, and that was because on that 5th week, when after we had to cancel a class, the weather was still quite rainy, and we still went along anyway. So we had 15 people purchase their own poles to continue Nordic walking on their own. And we have set up a pole hiring system as well, which does get used. So that's been really great for our community. Just as a bit of a testimonial, we had one participant from Bright who needed to use her 4-wheel walker to ambulate outside her home. After coming to the group, she decided to buy a set of poles because she found the poles useful. And she stated, "I feel like I have a new pair of legs." So it was a really great sort of individual outcome. She now has set an achievable walking route outside her home where she walks with the use of the poles twice a day, and something that she's had confidence then to do that she didn't have to do before attending the sessions, which has been really great. And so that's sort of on that more individual level. What we really didn't expect was the longer term outcomes. And so after we ran these 4 sessions in each town, we had interest in Myrtleford group continuing to meet casually on Fridays. So sometimes they walk with poles, sometimes without. And that had happened for months after the project ended. I'm not sure where that's up to because I wasn't involved with that group at all. Mount Beauty also commenced a group through the U3A. So they heard that Bright and Myrtleford got Nordic walking groups and they wanted their own. So they ended up starting their own, and myself and Alpine Health provided some in-kind support to introduce the Nordic walking technique to them. And they have continued as well. And I also run a class, and I have been doing since that finished, so around 18 months now. It's a fee-for-service class, and I was able to engage some additional funding to help people to pay for that. So that was through Sports Australia, the Exercise Right for Active Ageing grant, which subsidises people, older adults, so 65 years and over, for 12 sessions of group activity or exercise, and it also includes an initial and final assessment. So additionally to that, in terms of my group, all of the people who come to my group are over 65. And they've really built up their fitness, their balance. I can see a marked improvement in how they, their functional capacity. We walk over varied terrain now. We started on paths. We're walking in the bush. It's really quite interactive, and I can just see so much confidence from doing this over that long term. They also meet independently 1 to 2 times a week because they love it so much. It's really good. And they have a coffee together and stay connected. So I suppose my concluding remark is that this project really did go above and beyond my expectations, considering we only had $2,000 to work with initially. And it's been really nice to see how such a small amount of money has helped in activating a part of the community who weren't necessarily able to, or not confident enough to be active beforehand. And it really how something like this can be quite sustainable and provide people also with the social outlet as well, to increase their physical activity and also have those health outcomes at the same time. So yeah, thank you.
Thanks so much, Leah. That was really fantastic, and I think the long-term outcomes that you've spoken about at the end there are really important, because it's not just programs won't continue forever, but those spin-off sort of things of people either transitioning across to the U3A or just taking it on themselves to form friendships, social groups, whatever. I think that it really demonstrates that programs like this are a catalyst for future kind of relationships.
If anyone would like to find out ask me any questions or find out further information, you can just contact me. I'm sorry, it's still underlined there.
I might just open it up.
I can pop in the chat.
Or comments. Has anybody got questions for Leah about the project? I might just ask one if I can, Leah.
Yeah.
A slightly different tact. I was really interested in talking to you prior to the event today, around this idea of private organisations kind of, coming into this space that's traditionally, publicly funded organisation, whether that's a health service or a local council or something like that.
Yeah.
I've worked in sort of health promotion for a while now, but haven't really done much work with private providers. Do you have any sort of ideas or ways that publicly funded organisations can connect with private providers like that? Because I think something like this really demonstrates the value that can come from these sort of partnerships.
Yeah, I suppose it's really depends on who you're working with. But as an allied health professional, there's definitely, we can get funding through different Medicare pathways and other pathways that might, reduce the amount of funding that a public service might need to put into it or contribute to a program. So I think mainly for me is working in collaboration with a private practice, if you've got an idea, is that you're opening up to having skills maybe outside the scope of the public service. So I suppose it would be very different in terms of, accessing things, and it'd really have to be more on a local level, but just keeping in mind that there are ways of working in together. I actually run the cardiac rehab service with Alpine Health in the Shire as well, and we do that on a private and public partnership basis. So I'm not aware that it's run anywhere else like that. It works really well. We contract, but we have we work together to deliver that program. So yeah.
Fantastic. And I think we've got a question from Anna.
Yes, thank you, James. Thank you, Leah. It was really nice, interesting presentation. I have to note that you have exactly the same number of participants that we have in our project. And we also, it was effective affected by COVID as well. So I think it was so interesting because you run the program at the same time we ran our project. So, you were doing, I just found that it was interesting. And my question to you, and I think this will make sense as well if you watch my presentation, is I'm wondering if there was any limitation, physical limitation in terms of the choice of the paths you can go with them, and how the towns were structured for you to run your Nordic walking, because this is something that we approached in our project. So I was wondering if there was nothing for you, if there was something there for you to note in terms of the natural and built conditions that you have to run these programs with older people.
Yeah, sure. So we definitely made it, we wanted to make it accessible. So by having the poles, yes, people are more ambulatory, but with there obviously some fitness and mobility issues with many of the clients that attended actually. So we made sure that we were on, smooth paths, no hills, and progressed from there as we got to know people. So luckily enough, in Alpine Shire, we have access to those types of pathways and linking, our little rural towns, so with rail trails and things like that. So, being able to utilise and initially having access to those pathways where people weren't at risk of falling over was really, we really needed to take that into account, I suppose. And now we've sort of branched out to the much more adventurous walking.
Great. Well, we might move. Thank you, Leah. That was really fantastic.
Thanks for having me.
We might move to our next presenter now. And we're also going to move from a program focus to a more sort of structural system environment kind of focus. So I'd like to introduce Jessica Wadeson. So Jessica is the acting team leader for population health and community wellbeing at Wodonga City Council. And she'll be presenting on a project that Wodonga has undertaken that looks at social connection from a systems thinking and a collective impact perspective. So Jess, I'll hand over to you.
Thanks, James. Hi, everyone. So my name is Jess, and I'm well aware that it's coming up with iPhone at the bottom, and I'm sorry for that. As James said, I work with Wodonga City Council, and we received funding from the Victorian government pre-COVID to undertake a project that focuses on social isolation and increasing pathways to social connection. Due to COVID, much like most of you have experienced, we had delays, and we restarted the project mid last year. And at the moment, we are heading into the implementation phase, but I can't talk too much about that yet. But I would love to go over the approach that we took in our planning phase and the challenges that we've come across and the barriers to social isolation that have come up for Wodonga. So we're halfway through our journey, and when we were in the designing and planning phase of our project, we really placed a high value on the importance of bringing our community organisations together. We felt that it was an opportunity as well to bring the groups together, particularly as COVID had sort of changed everyone's priorities, and it was an opportunity to bring everyone together, basically, and to help us drive impact in this space. We found that it was really effective in identifying the social connections and the barriers that Wodonga specific residents face. So I guess every city is different. You have different different cultures, diversity, transport barriers, and all of those sorts of things. So by being able to hear from all of our community organisations, we were able to really tailor the information to our city. And we sort of changed our approach because of COVID as well. At first, we wanted to conduct focus groups with our older residents before embarking on the journey with consulting with our community organisations. But because of the social isolation barriers already facing our older residents, we decided, given the COVID restrictions, not to pursue that. So we held an online forum with our organisations, noting that we would conduct surveys and focus groups during the implementation phase, which will be this year. With our approach, we actually engaged Deakin University to work with us to co-facilitate an online forum. And in this online forum, our main objective was to map, so systems map our social barriers so that we could really identify linkages and connection points. As we had, probably more than 10 organisations join us. As you can imagine, it's really hard to put down all of the information you're hearing in one spot and being able to connect it to really identify where to prioritise our efforts. So we had Deakin University use some technology where we had breakout rooms and we would discuss at length the barriers that our residents were facing. And when mapping the information, we were able to see what themes came out of the information. And we did uncover that Wodonga was doing a lot in this space. However, we might not have necessarily made the connection that perhaps it was in the creating pathways for our older residents. And if we hadn't made the connection, how could our older people make those connections? So an example might be that in Wodonga there's been new infrastructure go in, and there are pathways so that you can park your car and easily walk with a walker to our cultural facilities. But that awareness raising might not have happened where our older residents feel familiar and comfortable to do that. So I guess we really did identify what we had been doing in different spaces, but where the disconnection was happening. So we had identified a key barrier, which was ensuring our older people had the information that they need when they need it and how they need it. So based on our systems map, we were able to sort of identify 6 key themes that came out, and we when undertaking our or preparing our action plan, we broke those down into 6 calls of action. I'm just going to try and share my screen. Hold on 2 minutes. Okay. Can you see that?
Yeah, that's come up.
Yeah. So this is the example of our systems map that we were able to put together. So we had all of our community organisations identify where we were facing barriers, where older people would be facing barriers to connect socially. And you can see down the bottom, there were 6 key themes. So one was embedding older residents across our groups and events, age-friendly planning, intergenerational groups and events, information provision, amplifying their voice, and ageing stigma. So we've sort of been able to colour code those so that we can really see where the barriers are. And there was an extra bit of work that we did on top of this with the group, which was to pinpoint where we were doing something now so that we could work out whether or not what we were doing in that space was A, effective, or B, could we strengthen that? And should that be a priority for this project? So there were some things that came out with access to transport, but there are other things happening in the transport space, and we uncovered that perhaps it was more about information connecting to make sure that older people know how to access what they need to access to get to where they need to go. So I'll just stop sharing that now. So our 6 calls to action were based on those themes that you can see there, and I'll just quickly read through those. So our first call to action was to develop a consultative advisory group that represents older people to lead age-friendly approaches in Wodonga. The second one was to provide information that they need when they need it and how they need it. So that's really about unpacking what information is available. There is a lot of information available online, but that might not be necessarily the method that our older residents need to get the information that they require. So there was a lot of discussions about having paper forms of information that are available in lots of spaces where older people normally go, so that they're able to really pick up and engage and not have to rely on being able to access a computer or being able to go somewhere to get assistance to do that. Our next one was to reduce stigma and discrimination, ensuring inclusiveness of people of all ages. Promote generations working together through opportunities for intergenerational relationships and groups and events, amplifying the voice of Wodonga's older residents and embedding our older residents across Wodonga to break down the barriers to community connections. So throughout our group discussions that took place at our online forum, the themes really did emerge and a clear pattern was identifiable, and they did really align with the World Health Organization's Global Age-Friendly Cities Guide. So we were able to actually link those back to that guide, so that social participation, respect and social inclusion and communication and information. After our community forum, we sort of worked to align our actions within the 6 calls to action, and we formed a community action team. So it's called the Aging Well Community Action Team, and that's an opportunity for all of our organisations to now implement our action plan and really come together and connect. And we find that, you know, organisations have their own things that they're doing, but connecting their own pathways can mean that they could have more of an impact and maybe uncover something that they didn't know before. So this project has been an opportunity for us to really develop those relationships and connect people. So one of the biggest identified areas was information sharing, and we really we're focusing a lot of energy on developing an age-friendly guide, which would be available in hard copy form as well as online, but it's predominantly focusing on establishing that familiarity for older residents so that they can feel that they know where to go, how to access a social program or a facility that they might want to go to connect with people, and know how to get there, where to park, how to walk there, so that we're able to take away that fear of socially connecting. I guess now that we're embarking on the planning phase of our project, we do have some challenges, as all projects do, and one of them is with staffing changeover. So with COVID and changing of priorities and normal staff turnover that happens, some of the members that were part of our mapping work have moved on to other roles. So we're going through the process now of re-engaging new staff members to connect them with the age-friendly space and explain what it means and the journey that we're embarking on, so that we can really drive that engagement, because it is really important to achieving outcomes in this space. So one of the other deliverables, in addition to a guide that we're looking at doing, is establishing aging well champions in Wodonga. So we're probably going to start small and hopefully grow it over time. But it's about having champions in the community that can outreach and connect with older residents to break down any barriers to social connection and sort of drive that connection. And I think that that's a space that we might not have been able to do in the past, particularly because of COVID over the last 2 years. So I think that's a really exciting space for connecting people and getting them the information they need, and making sure that we're able to find out what other barriers there are. there's a lot of work to do in this space, and it's sort of the beginning of our implementation journey. But another aspect is that we're sort of working on is developing key messages and enabling or equipping our organisations to be able to embed an age-friendly lens over the work that they plan to do or programs that they might already have. Because there are things happening, and sometimes it's just about making sure that we're thinking about things from an older person's lens as well, to ensure that we get maximum impact on the work that our organisations and even the City Council that we do as well. So yeah, that's probably the main outline of our project. Does anyone have any questions?
Thanks, Jess. I might just jump in. So you mentioned a couple of times there I think one of the groups, the community action team that are guiding this work and the organisations you're working with. Are you able to give a sense of the types of organisations that are involved with this work?
Yeah, so we've engaged with some examples are the Wodonga Men's Shed, University of Third Age. We've got our Albury Wodonga ethnic group. We've got Westmont as some examples. And we've actually been engaging with some other groups as well outside of our forum when that happens. So our action team is sort of, if we come across other organisations that would like to be part of it, we would be open to that too. Another, our Albury Wodonga Leisure Centre, and we've also engaged our leaders in our hyphen area where we have cultural programs, and our community centres in Wodonga.
Great. Are there any other comments or reflections on Jess's work? I think it's really interesting the approach of doing that mapping exercise at the start, and actually kind of looking at that environment that residents in Wodonga are living in, and you can really see from that work that there's a range of physical kind of environmental factors, but also lots of, I think I mentioned before, those kind of intangible things like information provision or the relationships that people might have across the community, and to undertake that work really, I think, helps focus a little bit more and see it as it's actually not so much focus, but it helps expand the kind of work and where you can be influencing the system, rather than a very direct sort of this happens and we do this and then this change happens. It demonstrates the complexity of this kind of work and the way that you need to work in lots of different partnerships and with lots of different groups.
I think as well, I probably want to reiterate that we really did see it as an opportunity to work with our organisation, so that it's not all about us doing all the work, but from the perspective of like raising awareness and better equipping people with knowledge of how to have an age-friendly lens and being able to drive change on a macro level and across, have a broad reach, if that makes sense.
Yeah, absolutely. We've got a question from Mark Silver.
Oh, look, thanks very much, Jess. That was really fabulous. I've just got one little point about intergenerational programs, because I know you mentioned them, and I was very interested to hear very recently that Knox City Council have appointed recently an intergenerational officer to really explore that space, which is very innovative of them. I mean, council's always out, difficult with money to do this sort of thing. But I'm wondering whether the council, has it given any thought to developing that area of need?
In our council specifically?
Yeah.
I guess we have got actions in this project to undertake in that intergenerational space, and looking at ways where we can have you know, events and campaigns that target multi-generations, but not specifically having an officer, but our team that I work within, we have a broad range of responsibilities. So we would, we're always looking at ways that we can sort of be innovative where we can and have impact on all of the programs that we are undertaking. But I know in our specific project, we're going through the process now with the implementation phase, where we're having our organisations put down on paper everything that they know of in our city and that they're doing within their organisation, so that we can map how we could strengthen it, or how we could have a lens over it that is across all of our 6 calls to action, which includes the intergenerational approach.
Thanks very much.
We've got another question from Richard Joseph.
Yeah, thanks, Jessica. Yeah, I'll probably have a email discussion with you to find out more about your approach, which I think is really great. I think in relation to the intergenerational stuff, I mean, it's great that Knox, council's got the resources to be able to fund a specific, role like that. But in terms of the, I suppose the intergenerational, I mean, we can still work with youth services within council. I know that quite a number of my colleagues here in the Eastern Metropolitan region have done intergenerational work. So for Maroon, we've done letter writing and story writing competitions on an intergenerational basis. And we piloted Gen Connect, which is we've identified a number of older volunteers who supported kids in our vocational care program. So that was just during the pandemic. Unfortunately, we couldn't see the whole program through because of the restrictions, but there was sufficient, I suppose, benefits there for us to want to try to continue that when we are able to again. So I think, in terms of the intergenerational, there's been lots of, I think, lots of focus on intergenerational work now. I think mainly through the ABC's program, but there are opportunities within council where youth services and I suppose the age services or community services within council are able to undertake that.
Definitely.
Can I just mention just quickly, there is a new group called the Australian Institute of Intergenerational Practice. That's a national group that has just started, and they've got a terrific website and looking for membership, and I am part of that group. And I think if anyone is interested in intergenerational work, they started with this old people's home for 4-year-olds, which we all saw, and the next one on the ABC is going to be one with teens. That's the next group that's coming on board the ABC. But there's also story work and a whole lot of other wonderful work that's been done. So I would encourage anyone to, I'll put it in the chat, their website. So I just thought I'd mention that. Thanks.
Thanks, Mark. And just on your point, Richard, I think that's a nice callback to one of the presenters last week, Helen from Latrobe Council out in Gippsland. Oh, sorry, it's just a thunderstorm starting. Where they were looking at, creating all the clubs and groups in the area to be age friendly. So it was, encouraging this intergenerational mixing without consciously, setting up programs that would have generations mixed. But it's saying that all our groups and our clubs and all that sort of thing are welcome for anyone of any age, as long as they're interested in whatever that club happens to be doing. So we can see that there's different ways of approaching this intergenerational mixing idea. So there was just one last comment in the chat, Jess from Meg Thompson, just wondering if you would be able to share your email. That she loved your work, so interesting. Yeah. Great, so thank you, Jess. That was really fantastic to hear a bit more about the work that Wodonga's doing. And we're going to continue the focus on the environments that people live in and move to our next speaker, which is Dr. Anna Horta. So Dr. Horta is a senior lecturer in spatial sciences at Sturt University. And her research project focused on livability in Indigo Shire, and specifically looking at the walkability of Chiltern and Rutherglen, and how a physical environment promotes or hinders social connection. So I'll hand over to Anna.
Thank you, James. Thank you, everyone. Just share my screen. So hopefully you can see that. Yeah.
Yeah, that's good.
Thank you. Yeah, thank you so much for giving me this opportunity to bring here our project. As I was saying before, when we got together in our breaking room, so I'm a geospatial science lecturer. It's sometimes difficult to explain to people what I do. People hear the word geospatial and they immediately go like, oh, this person must work for NASA. I don't, unfortunately, I'm not that smart, but we do some pretty cool things with geospatial data, which is basically, if I want to summarize it in a very easy way to understand, it's just data with location, okay? And you can get this data by collecting data with a GPS. This could be data from remote sensing imagery, things like that. So in our research at Sturt, geospatial science research, we develop a lot of environmental applications, but lately we also have been developing applications that have a focus on health and also livability. So it is in this context that we have developed this project, mapping livability in the Indigo Shire. This is a work that I've done with my colleague, Dr. Rachel Whitsett, and also in close collaboration with the Indigo Shire Council, namely with Cato Tool. This project was also funded by the Northeast Catchment Management Authority. So in terms of, oops, sorry, so just changing my slide. So in terms of what we mean by livability, you might have heard this term before. It's becoming quite trendy at the moment. It can mean a lot of things. I mean, you can approach livability from a lot of perspectives. With our work at the moment, we're just approaching it from the side of walking infrastructure, so adequate walking infrastructure, and also sufficient and appropriate public open spaces, because you can not only collect geospatial data that can explain behaviors around these two aspects, but also you can relate these two aspects with health outcomes. So in terms of research, the gap that we have identified is that there has been a lot of work that has been done internationally and also in Australia about quantifying livability, but that work has been done mostly for metro cities, you know, where livability does have a different meaning than it does in regional individual cities. You might just want to think about how metro cities organize themselves and how easy it is to access a supermarket, for example, and how easy it is to even get to an open space. And if you think about our regional towns where everything seems to happen on that main street, right? So there's only one way to go, and we just have to adapt to that. So we found that research gap, and we also found out that sometimes these studies on livability, they're not always considered the needs of specific demographics, and I mean, what I mean by this is they don't consider sometimes the needs of older people, for example. So why does this matter? Well, you will know this better than I do. There's a trend on the population getting older in our regional cities here in Northeast Victoria. So it is important that we try to initiate this moment or consolidate this moment on creating age-friendly communities. So, and that goes by acknowledging not only what that means, and I just brought here just a list of some aspects that are included in the list for age-friendly cities. So not only what those aspects are, but also what are the barriers that we have currently in our regional towns that might delay or prevent these aspects to be implemented. So in terms of how when we run this project, we did this as what we call a research co-production. It's just a fancy name to say that we didn't work all ourselves, you know, we just didn't have this brilliant research idea and just hide in our offices in front of our computers and did it ourselves. we actually tried to bring in as many people as we could to the conversation. So we worked very closely with Indigo Shire, of course, also with the Northeast Catchment Management Authority, but also with WELP and other partners, because we also ran this program or this project in Albury a few years ago, when we also bring in people that help us build up the research ideas for that project. So it is called research co-production because it tries to capture what do people think about livability, so different perspectives, and how can we address that with the work that we do with geospatial data. So some of the key research questions from partners that came out of that co-production work are these ones. Probably the ones that I'm going to focus more on this talk today is this one: where, why, and how are older people walking, and how can this help the councils to actually address that list of aspects in the age to become an age-friendly town or community. We have chosen 2 case studies, Chiltern and Rutherglen. From the pure research point of view, this was because we have done that project looking at walkability in Albury, and so that's for us a regional city, and we would like to compare the results from that with a smaller sized town like Chiltern and Rutherglen, but that also aligned with the Indigo Shire planning, where they had like a few projects going on for these 2 towns, and so our work sort of like fed into that as well. So basically, like I said before, we're going to look at livability from the lens of walkability, and also how people use public open space, and also what are their attitudes towards nature. So mainly focusing on the experiences of older people in our regional towns. So obviously walkability is a very specific thing. It's basically a measure of how the built and the natural environment encourages or limits physical activities. So this goes back with what Leah was saying before, you know, how important it is to get that older people active, and walking is such an easy way to do so, right? So not only that, but from the research point of view, if you're able to map or measure that walking behavior, that actually provides you lots of interesting insights on how people connect with the natural and the built environment. So that's pretty much what we're trying to do with this project. And also ultimately, you can also relate walking behavior with health outcomes. So these were the 3 objectives that we had for Indigo Shire. So measuring and mapping walkability for older people in both Chiltern and Rutherglen. We also want to evaluate the participation of older people and in recreation and also in active transport. And most fundamentally and very important, to examine, you know, what were the attitudes, barriers, and opportunities that linked how people valued nature and how they interact with it. So in order to do so, we need to collect all heaps of data. So you can see here that this is what we called a mixed methods approach, in the sense that we combine data that is collected quantitatively with data that is collected qualitatively. So that's what we try to do. And so for me, the most important will be this one here. So we asked people to carry, so we gathered participants 65 years and older, and we asked them to carry a GPS activity tracker, which looks something like this. I don't know if you can see it. So it's a really lightweight device like this one that they can carry on their neck or in their purse. And this basically records where they go and when they go places. So we asked them to use this for 1 week and to basically turn it on every time they left their house to do some sort of walking. So this could be walking to go to the shops, what we call active transport. It could be recreational walking, or it could be walking for physical activity. To recruit our participants, we run public sessions, just distributing information about the projects. We did one in Chiltern and one in Rutherglen, and we also relied on word of mouth from community groups like walking groups, etc. So that's how we gather our participants. Then we also did interviews and focus groups. So this had to be run online because of COVID restrictions. And basically on these interviews and focus groups, we were just trying to gather data on what are the people's attitudes towards nature, and what features make those open public spaces and the national parks more attractive to them. So that was the focus of that. We also did observations. So observations are basically a way of recording a snapshot of activity at specific locations. So that's basically a team of 2 people placed at specific locations throughout the towns, focusing on open public spaces and natural areas, and just record how many people go there, what are the demographics, and what activities are they doing. So are they walking, are they running, are they sitting down, and things like that. And then we also did some surveys. So we had a specific survey that recorded activity behaviors and also health outcomes. And this survey was distributed to our participants. So the participants that carried the GPS for us. And we also did a general survey that was made available to the general public through the Indigo Shire website. So we got all this data, and I'm not going to get into details here. Hopefully I can share the link to the report with you. There was a lot more detail than the one that I'm going to bring here. So I'm just giving you a highlight of the main things, the main results that we got out of our report. But there's more, because as you can imagine, the quality of the data, or the diversity of the data that we've collected, allow us to do many more in-depth analysis. So these are just the survey responses from the 32 participants that agreed to carry the GPS activity tracker during that week. So we run this from January to March 2020, and then from April to May 2021. It wasn't initially supposed to be like this, and we had to adapt to COVID restrictions. Also, this was impacted in terms of running the interviews and the focus groups. Our intention was to make this more open and have more people joining in, but unfortunately we weren't able to do that. But still, we had 32 participants. We're very happy with that. Also, these participants had a really nice spatial spread around the town. So hopefully we were confident that our results really communicated, the walking patterns of the people living in these communities. So as you can see here in this bar chart, this basically tells you that most participants, they consider that Chiltern and Rutherglen, they're walkable towns. So the most responses were captured here for, it's just about average. But if you just count the responses for about average, above average, and very walkable, you can see that in general, they consider their towns walkable. In terms of where do people walk in Chiltern, and most likely this will not come as a surprise to you. So in terms of the walking patterns, let me just tell you how this map is made. So basically, with the data that is collected in the tracker, we just download this data. So this will be coordinates along all the paths and roads that they have walked on. And we aggregate this data. We aggregate the data from all participants so that you cannot identify where these people live and things like that. So everything, the data is cleaned up, is aggregated, and then we produce what we call a heat map. Okay, so a heat map basically shows you the intensity of walking in this case, or walking frequency. So in the areas that are dark blue, that's where people walk the most. And the areas, yellow, whitish areas are the areas where people walked less. So no surprises here. You can see that most walking, if you're familiar with Chiltern, you can see that most walking was done on that main street. And then specifically on the section between the Chiltern Medical Clinic and also the Memorial Park. And this is where most shops are located. There was also some activity around the Lake Anderson in Chiltern, although not as much as we thought we would see, but these were the walking patterns that we got from our groups of participants. I should say that from those 32 participants, I forgot to say about that, they were half-half. So about 16 were from Chiltern and about 16 were from Rutherglen. So this is the walking map for Rutherglen. Again, a very similar pattern, a very similar walking pattern than what we saw from Chiltern, in the sense that most walking occurs here on the main street where the shops and the services are located. You see also here some activity around Lake King in Rutherglen, and there's also some activity in the rail trail or the bike trail as well. So also looking at the responses from the survey, we try to pinpoint, what were for our participants, what were the features that they considered to promote walkability, and on the other hand, what were the features that limited that walkability. And it's immediate from just looking at this and these two tables that footpaths matter for these for our participants. So they consider that having a good existing footpaths and the fact they're in good conditions are considered by our participants as important factors to make them walk. Either that is walking to the shops or walking for physical activity. And then on the other hand, factors that they think limit that walkability is the fact that footpaths might be lacking, that might be uneven, or are in poor condition. And you can see here, interestingly, also as the second most important factor for children participants, they consider that shade is important. Whereas for Rutherglen, what came up was the pleasant scenery. And I think that these are interesting things for us to consider, and I'll come back to that right at the end when I talk about our recommendations, because there's that general idea that if you live in a regional town, then you're lucky, right? Like you have lots of access to nature, you're living in a perfect, beautiful environment. It's not like living in the city, right? And still people don't seem to walk as much as we thought they could walk, particularly older people. So in terms of the footpaths, just to show you here a few comments that we graphed from the focus group and also our surveys. Of course, what we see here is that there's a higher walking intensity on the streets that have footpaths, and that intensity decreases. Obviously, this is biased to our participant group, but this just translates the importance of having good footpaths to walk, particularly if you are older. This also aligns with the responses that we got from the interviews, the focus groups, and also in the general survey. And by the way, this also aligns with the results that we got for Albury. So in Albury, when we did this project 2 years ago, footpaths were the main concern of older people, being able to go where you want to go, walking, not having to use your car. And for that, you need to have a good footpath. And a good footpath for them is a footpath that is not uneven, right? That allows you to walk smoothly without having the fear of having a fall, for example. Also, there was a strong consensus from our data that lacking footpaths was a worry for both children and Rutherglen, but this seemed to be a bigger problem for our participants from children, if we compare the two responses. And in terms of the natural features that prompted walkability, the two lakes in both towns were definitely places where people would like to go and walk. And this was more true for Rutherglen. So we saw more activity on the lake at Rutherglen, and not so much in the lake that we have in children. And some of the reasons that were pointed out by our participants were the lack of ways of getting there by walking, that you sort of like need to drive there, or they didn't feel safe enough to walk there from the town center. Right, so in terms of the other aspect that we were trying to cover with our projects, which in terms of how do people engage with nature and open space, and these responses are mostly from the interviews that we did and also the focus groups that we did. So basically, I think in general, there's a strong connection with nature from both participants in children and Rutherglen. For example, in children, there's a strong sense of connection with the national park. People feel connected to that space. And they like to enjoy simple things like, watching the season change in the park. With Rutherglen, there's not a specific natural feature that people could relate to, but again, here the lake seems to have that importance. So people like to go there and just watch the wildlife, using the lake, like seeing the ducks and things like that. In terms of who they think are responsible to maintain and reinforce or create opportunities to engage with nature and open space. Our participants from both children and Rutherglen were very keen on saying that they think it's up to the council to prompt these connections and to also look after the environment for them. in terms of our recommendations, and you know, keeping in mind that we would our work was to help Indigo Shire to foresee in the future or putting in place in the future programs that will help foster these age-friendly communities. Obviously, improving the footpaths and identifying locations where new footpaths might be placed to improve connectivity is a big one for us. And I think this goes back to the fact that sometimes if you live a little bit away from your town center and you just want to walk to town, you might not have a footpath to guide you there. And maybe for some of us that are not afraid to walk everywhere, or we don't mind getting into the car because we get our physical activity from elsewhere, maybe we don't notice this, but for all the people living in these regional towns, the idea of having a way of getting into the town center without having to hop into their cars was really, really important. Also, I will highlight this one here, locations of interest, because for them, it was quite boring to walk around. Some of them would tell to us, look, you just go around the town center 1, 2 times, 3 times, and then it gets really boring and you're always seeing the same things, you know. And then we ask them, well, but why don't you go to the park? And they go like, well, we don't have footpaths to get there. So I think there was a sense of creating connected streets and connected spaces where you can go for different walking paths. If you go down to your house, you can go right, you go somewhere, you go left, and you go somewhere, you know, having that diversity so that you can cross with different people, you will see different people, you'll see different things. Also, the locations of interest are like having opportunities throughout those walking paths to see different things, whether that be say, for example, a notice board with things that are happening in the community, or maybe an art installation that can call your attention and things like that, just to make that walk really interesting and you know, give you that extra reason to go out for a walk in your day. And that's pretty much it. I'm sorry if I talk too fast. There's really a lot of detail in the work we did. So I invite you to look at our report. I just would like to thank again my colleague Rachel Whitsett for working with me on this, and also all the support we got from Indigo Shire and the Northeast Catchment Management Authority, and all those people that help us to make this project a reality. Thanks so much for your time.
Thanks, Anna. That was really fantastic, and you know, really great look at the physical environment and the way that can either, you know, facilitate or you know, hamper opportunities for the social connection. So I'll just open it up for questions on Anna's project and anything that was in her presentation. I've got one from Kathleen.
Thanks, Anna. That was terrific, and I've read the report, and I would certainly commend it. I mean, there's certainly good evidence now around the importance of blue space, so views of water and connection to water, particularly for people who don't live by the sea. So there's an evidence that if you have contact with water and you're not living on a coastal community, then it improves your mental health. And I'm just wondering about, is there an understanding of the interplay between seating, water and walking paths? Like, how much of this is multifactorial, do you think, that there's numbers of things that assist people to walk more?
Absolutely. Can I just say that I live in Albury. As you know, we have a beautiful river and we have a lake, but I love the ocean. And that has a strong effect on me as a person. I have to go down to see the sea every 3 months. That also perhaps because I'm Portuguese and we have a strong connection, but I totally understand what you're saying. And I think that's exactly what it is. And I think that's, for me, in my personal opinion, a missing perspective when we plan our towns to be age-friendly, and if we want to foster walkability, is to give those people those elements that they can look forward every time they go for a walk. So that could be the water. And for me, water has a calming effect. Although I like to see waves, so I know it's a bit of a contradiction, but I like to see waves like washing away my problems. But I know I've heard this from people before, how they love to see the river, how they love to see the lake. Not only that, but all the wildlife that all these places attract. So it's not only that, it's not only the water, but also other landmarks. So I'm thinking about the national park in Chiltern, which you would think would be a great point of attraction, but you know, how far those people have to walk from the town center to the national park, and if you get there, how tricky it will be for older people to actually navigate those paths, right? Because they might not feel safe. So we sort of need, or at least I think that we need to create in our regional towns, in particular, points of interest. I'm going there to see the water and the ducks. Then I'm going there to see this art installation. I'm going there because, you know, there's always an activity there posted for me to do, whether that is for me to take photos of what I see when I go walking. I think that's really, really important. And maybe in the cities, I don't know, I think maybe in the cities, because it attracts so many people and so much movement, if you go for a walk there, you always see different people, right? You always see different things. So that's a given. Whereas if you're in a regional community, that's not necessarily the case. It really surprised me, and again, I have to note this again, our results are biased by our participants, right? I'm not saying that I've captured all, you know, the feeling of the whole population in Chiltern or the whole population in Rutherglen, but people did seem disconnected. And of course, COVID would have to have a play in this later on. But when we started doing the project, COVID was still not a thing. And people were still feeling disconnected, how they do not connect with walking groups. So I was thinking about Leah's initiative and how good it would be to have something like that perhaps going on. Yeah.
Can I just a couple of comments on the mental health and water. We know that when we suffered the millennial drought and some of the lakes in the region dried up, that there was a great deal of grief associated with the environmental loss. And I'm thinking particularly of some work that we did around looking at age-friendliness and livability up in Towong Shire and for people around Talangata. The other thing about linking older people and the natural environment, there's, for some people, that it's the natural environment and their connection to it that drives them outside. So they see difference on a daily basis with birds and flora and fauna. And so I think there's an important role in that connection being made more explicit for some people, and particularly for people who have moved here that didn't grow up here. That's a really important step. And the third thing is that there was some really good work done in, I can't remember which province of Canada, and I'm thinking it was, no, I'll get it wrong, so I won't say it, where they linked occupational therapy students and older people, and they actually reviewed all of the paths that were associated with national parks or walking paths, so that they graded them according to older people's perspective of those. So where were the seats, where were the toilets were important, but also where were the natural features that had meaning to people who'd grown up in those areas or who missed being able to go hiking as they've now become more frail. So there's a really interesting interplay that I think offers a fabulous range of opportunities. So thank you, because this work is really groundbreaking for us in the region.
Oh, thank you. That's wow. After coming from a class this morning from 9 to 1, where they just look at me like, what are you saying? That's really refreshing. Thank you so much for that. And look, I don't think we did. I think perhaps the most important thing that we did was just to put a number next to it, or just show you how we can look at this from different perspectives, because I think the knowledge is there, and we definitely have the conditions, the natural and the built conditions, to foster walkability more and livability more. I think it's just a matter of starting the right conversations, looking at the right things. Yeah, thank you.
So that's probably a nice point to finish on there. So I do want to thank all our speakers today. I think there's been some really fantastic presentations, and really 3 different perspectives in the way that we're understanding and conceptualizing this idea of social connection and participation. We saw the way that we can address from a systemic perspective and looking at the physical factors that facilitate or hinder social connection. But I think equally, you know, with Leah's project, we demonstrated that there's a role for a programmatic response and identifying the opportunities for communities to connect within these supported environments. And you know, particularly with Leah's project, I think, you know, in response to a crisis event, it really shows there's a space for renewal and a space to bring people back together and to move forward. So thank you to everyone who came along today. Thank you to our presenters. It was really fantastic having such a great group here and so many great comments and questions. So we've got another couple of events coming up. Naomi, if you could just drop the registration links into the chat. So our next event is Tuesday next week, which is International Women's Day. And this event, where it'll be a conversation hosted by Dr. Kathleen Brasher. And Kathleen's going to be joined by Fiona York, who is the Executive Officer of Housing for the Aged Action Group, and Dr. Katrina Rayner, who's a postdoctoral fellow in affordable housing. And we're going to be exploring the relationship between older women and housing. Older women are one of the fastest groups to experience housing vulnerability and homelessness. So the discussion is going to look at what are some of these drivers behind older women experiencing this housing insecurity, and what sort of, you know, local preventative responses we can take, but also how can we respond better when housing insecurity occurs. So I think that's going to be a really fantastic conversation, and it really gets to the heart of you know, age-friendly communities when housing is the foundation aspect that we all need to be able to, you know, age well and do all the things that we want to do at any age. And slightly aside from outside of the age-friendly Northeast Victoria work is the Indigo 4Ms project. So this is a project that improves health outcomes for older people within health services by focusing on the things that are most important to them. So these 4Ms are what matters, mobility, medication, and mental health. And this is going to be a face-to-face event, so really exciting that we can hold a face-to-face event again. So if you happen to be around the Beechworth area next Thursday afternoon at 2:30, we'll be holding the event at, I think, at the George Curford Hotel. And we'll be, that's be hosted by Kathleen again, and we'll also be joined by Dr. Helen Haynes, who's the member for Indi. And the event is really about launching this project and I guess now that we've done some of the background work, taking this work forward. So again, thank you for everyone who came along today. I'm just going to drop a link into the chat as well to sign up for our age-friendly Northeast Victoria newsletter. So we're going to be launching this in the next couple of weeks. And it's just a great way to keep in touch about future events that we're holding, different research coming out, some commentary on research and you know, looking at key issues that affect age-friendly communities, and just a good way to keep in touch with us and hearing about the work that we're doing. So thank you again. We've finished right on 3:30. So have a great afternoon, and I look forward to seeing you at our event next week.